I'm going to go through our process of implementing CAQH and the COB Smart. Michael Spivey, who's a senior manager and responsible for COB on my team, he's unfortunately in Florida and wasn't able to present today. So I'm going to kind of look at his slides and talk to his slides. You know, I'll be open for questions afterwards, but hopefully I'll be able to kind of give the same, points that Mike wanted to speak to as he was presenting.
One thing, if you do have questions and you don't want to yell from your table, you can. So there's a microphone up here for anybody that has anything specific.
Okay, and then one other person that's virtual and online right now is my senior business analyst that focuses on COB, Destiny Thomason. She'll also help with the Q&A portion of the session.
Hello, everyone. I'm here. Are you able to hear me?
We got it. Right,
Good.
I gotta be careful. I gotta be careful how close I hold this mic to my mouth. Okay. All right. So obviously, Director of Enrollment from CareSource. We are a government programs type plan. We manage Medicaid, Medicare Advantage, Marketplace, and our mission is to make a lasting difference in our members' lives, improving their health and well-being. Our vision is transforming lives through innovative health and life services. And so what I'll go through today is the steps of implementing CAQH, the criteria for purchase, implementation, best practices, lessons learned, and next steps.
One question for you, Armando.
Sure.
How long did you guys think about COB Smart? Probably 2 or 3 years before we started getting you guys implemented.
Yeah.
As
So
a lot of you know, it's quite a cycle, a long cycle to work with COB Smart and same with them.
So when I started at CareSource in April 2020, and you were one of the vendors identified to kind of help improve our data and our policies for COB. So we were thinking about it for a while, but I think
now
here we are.
2-3 years
You
later.
have to, and I'll talk about it as we go through the slides, but really you have to go through a proof of concept to kind of understand, what the data looks like, what kind of improvements going to be made. So some of those things kind of came out through this process and why we decided to move forward. And, I'll speak to that. But so why do we need COB Smart? So looks like some stuff's missing on the slide, some images, but, vendor partners, so a lot of us work with the different vendors. We know who they are. Sometimes they'll charge you per policy. They'll charge you for an update or a term. So obviously it's a very expensive process. The updates, there's delays in the updates when we get determinations, the ads and things like that. And then the validations, the information on there, the accuracy. There's a lot of things that are challenges with the current partners or vendors out there today with COB. And then other eligibility sources like state files and things like that. We find that the quality on those files can be inaccurate, or the updates on those files. So sometimes we find that creates more access to care issues. We want to look for a reliable source that gets us the policies, within the 0 to 60 days, ideally, preferably the 0 to 30 days. So what we have here is, our experience with some of the other vendors as far as getting the policies from the beginning of the policy age. And you'll see that, within that 1 to 30 days and, 1 to 60 days, it's pretty much under 50%. So, what this creates is a lot of getting the information later on, adjusting claims, a lot of provider abrasion, and the cost avoidance up front, paying that claim appropriately up front. There was a lot of challenges and we needed to do better. So we started to look at other organizations, and CAQH was one of them. We want to obviously minimize overpayments, decrease the COB costs per members, use the vendors more effectively, make better use of our staff, and deliver an improved member experience. So obviously, with a lot of the data that we were getting, prior to CAQH, there's a lot of validation that has to go on. There's team members that we have to assign. Destiny, her specific focus is COB, so data quality. So I actually have a person full-time validating the information we get So we want to lower the costs. We want to improve the data. We want to be able to have our staff focus on other things, improvement and things like that.
Armando, would
yeah.
you recommend a data analyst for folks, implementing COB Smart as far as
Yeah, from an implementation standpoint, I think it's critical to have somebody that really understands the data that's coming through, understanding how it's getting loaded into the system, and be able to validate some of the information that's coming in. So I think that would be an asset.
We're actually going to start recommending that. It makes a huge difference when folks really understand the data that they're getting. So when they do put in processes for automation and things like that, they know exactly. Oh, I'm sorry.
2.2 million. Yeah.
In Ohio.
Altogether 2.2.
Altogether.
Yeah, 2.2. Yeah. Right. You get into data feed, but you need, as far as the implementation aspect of it, you need somebody to really make sure that the quality's there, that the policies are timely, that and we have Destiny on the phone, and Destiny can kind of give you some of the things that she does, but obviously it's
how to build
from
your
a-
processes
yeah,
around that.
what's
Like,
that?
understand how to
Yeah.
build your processes around the data that you're getting.
Yeah, and you also need somebody on the business side to really work with IT to understand how things need to be loaded, and what's the hierarchy. If we get something from the state, or if we get something from CAQH, or we get something from another vendor, they help with that process with IT, setting up that business hierarchy.
If you're using the word policies, can you just clarify what you mean?
The commercial policy,
Their coverage.
the other coverage,
Their coverage.
the other health insurance. Yeah. Any other
Any
questions?
other questions? Okay.
So this chart here just shows the states and the penetration that CAQH has, and we highlighted two of our biggest markets, which are Ohio and Georgia, and you'll see that there's a 95% penetration in those markets. So, and I think that this is a chart that you have, and you probably share with the prospective clients.
Yeah, it's
Yeah.
our goal that eventually folks won't be able to ignore our data. We'd like to be. Ideally, we will have when we reach nirvana, right, and everyone is using COB Smart. Really drive that efficiency through the whole industry.
So a typical implementation, the timing is anywhere from 0 to 120 days. We were able to implement it within 90 days. I think probably the process that took the longest was the contract negotiation and getting that going. But once we were able to establish that, we were able to implement pretty quickly. I believe in September we started, and by December we were ready to receive that first file. So
you guys did a great job, Eric.
Yeah.
Thank you for that.
and Eric was part of that.
The pandemic was raging. The Christmas was coming, and we had a shutdown. So that was
Yep.
just a few hurdles.
Yeah. Okay. And then actually, I just want to point that out because on average 300 IT hours. So you have to, one of the things that we'll recommend is it has to be a project. It should be handled by a project manager. Being able to set milestones and deliverables and things like that. When we did it, we did not use a project manager. We used my business analyst. We used Mike Spivey, my senior manager, for the implementation. But I think that it would have been a smoother process if it came in through a project. Okay, and then obviously these are the timelines. We set up the SFTP in 2021, September 2021. We started to create the data files, the eligibility files that we were sending over. We were able to launch in December of 2021. And then Destiny sampled records from CQH file to determine the level of data integrity. So it's the quality behind the data.
What did you find? Oh, well, you're going to tell us. I'm sorry. I don't want to be a spoiler.
Yeah. And then, we obviously reviewed the data, looked into how we would automate and load the information into our system. Right now, though, when we get our file from CAQH, it's not automated. Our IT has a process that loads it in. And I think we want to do that until we're comfortable with the process. Once we're comfortable with what that process is and we have months of successful loading, we'll look to automation.
So you're not auto loading the overlaps right now. Yeah.
Yeah.
But that's the plan.
Yeah.
And we actually recommend that. It's really important for you guys to really understand the data before you build a lot of the IT processes at times, just so, again, you know exactly where you want this data to go. That we recommend actually phasing in automation. You have automated other areas, right? As far as, and Destiny, you might be able to speak to this, and again, we don't have Michael with us today. Certain aspects on the file, whether it's, and Destiny, can you hear me? Destiny, can you hear me? Just can you
It's hard
talk a
when you
little
don't-
bit about some of the automation you have done with the file? And I believe that's more around file maintenance than it is auto loading.
Right, so we have pulled out the aspects of the file, the validation, making sure that the other payer validated, that the primacy has been determined. Those records are things that we want to auto load. And so right now IT is doing that based on the parameters that we've set up, but they're just working to get all the connections done to make it automated now. So there are key fields that we can use to
Okay.
go ahead and
My understanding too is that you guys had, you were starting to see a missing record increase, which is a data quality issue. You know, there's something in the file. My understanding is you guys actually went through a fix on that.
Oh,
Was that part? Was
yeah,
that part? Of the
there
automation?
were missing fields that were causing those errors. And so once we realized that those fields were actually required instead of recommended, then we added that information into the file, and now we're seeing much lower error rates.
Yes, we have changed some of our labeling, if you will. We certainly have mandatory fields that are necessary to exchange the data. And then we also have, now we put, instead of recommended, required fields. And those are required fields for primacy. And again, sometimes, peers can't always deliver every field. The more data that you give us, the better your outcomes are going to be. And of course, the implementation team will work with you to make that happen. So.
And then this chart here is CAQH chart. It pretty much speaks to the standard implementation process, all the things that you have to kind of go through from securing the approvals, the review of the file specs, submitting the files for testing, the submission of the data, and then kind of the full dress rehearsal, and then eventually go live to receive the first full file. Currently, with our plan, we create a file, we send it out on Monday, and then we get a response back on Friday, and then our IT team loads it on Monday. So it's kind of a cycle. And then from a loading perspective, we're loading about 70% of the records that are verified that we receive. And the reason it's 70% is because 30% is data we may already have. So we're not loading it, but it's 70% of the information is being loaded.
Can you clarify what you loaded?
I'm sorry?
Or you
Not auto loading it. I think you're consuming it.
Consuming it.
Right, bringing it in.
Bring it into our eligibility system.
Can you talk a little bit about, we've had questions like this. This file comes back to folks every week. Typically, they have to create an Access or SQL database to consume this data and be able to distribute out, where it needs to be. I think, Destiny, I know you're on the phone, but my understanding is, again, we really do work with folks to maintain this. When you guys first went live, and we do tell people, we typically at least double the amount of COB you're going to receive, when you first go live. Destiny, I believe that the database that you guys built, was it able to handle all of that volume on the first go?
In an Access database, definitely not.
Yeah.
We had to wait for it to be loaded into a SQL database,
Okay.
into our main databases. I did try with Access, but it was just entirely too much information coming in at once.
Again, so we look to, not only, the folks here at CAQH, but certainly other clients to talk about their go live experience and what their strategy is around go live. So
right. Getting that data staged was super helpful and super important. And unfortunately, it took a little bit of time on our side. And so that delayed us getting the data into Facets. So that's definitely a lesson learned.
Okay, any questions about that before we move on?
When you say staged, what does that mean?
Destiny, the question was when you say the data was staged, what do you mean?
Staged so that I could use SQL to query it, staged within our tables, instead of it being a text file that you maybe are trying to get into an Access database or trying to work with through Excel. It's just not going to work. It really needs to be stored somewhere that you can use other query options.
And that's not available in that.
No, we're a drop-off pickup service on data, so you guys have to develop these tools.
What about I don't know what
The portal?
yeah, it's not in there.
No, all the data, the portal,
It's more of individual lookup.
yeah, it's
or,
individual.
or communicating with other plans to try to get updated information if it's
Yeah,
not there.
The portal is updated with the file as soon as that's returned, but also around data validation, that's real. As soon as that overlap is identified and validated, that's updated real time on the portal. So again, sometimes validation can be maybe 10 days earlier than the file return. So very important for your high claimants and things like that.
Okay. This next slide here is really the selling point and why we decided to go to CAQH. And as you can see, the graph on the left is the one I showed earlier with the policies and the age behind the policies. And now when we went to COB Smart, you'll see that a bulk of we're getting the information 1 to 30 days, much faster pace. And coincidentally, when we were kind of reviewing this data, when I was reviewing it with my senior vice president, he pulled up a claims Power BI model, and it showed that our COB denials have been progressively going down ever since we implemented CAQH. So again, preventing provider abrasion, paying the claim correctly up front. These are some of the things that we're starting to see. And so again, I don't know how many of you kind of track this on your end, but this is big for us. It helps with the provider relationship. It helps, saving money on the state side. So this is very critical.
And continuation of care.
Yep,
right,
exactly.
for your members.
Yep.
So it's super important.
Yep. So I know that CAQH provides a calculator based on different parameters, and you can plug in the numbers, and it'll show you what your potential cost may be the first year and what your total return on investment would be. And I think that's pretty telling. And I know that when we first implemented, we saw a nice return. So this is pretty accurate. It's definitely a return on investment for sure on year one.
Yeah, well, we're pretty excited that, from going live, I guess it was the end of December, not necessarily 2022, but to certainly have Armando and team up here talking about their results in 9 months we're pretty excited about that. Yes, Marcel.
What's the impact to the operational area as far as FTEs?
So there's still, right now we haven't seen much of a change because we still have other things that we have to validate from a COB perspective. We'll get emails, we get providers, we have the 837 claim file. So, but it does minimize the quality and the checks that have to occur by a specialist that work this, our COB specialist. It does minimize that inventory. And actually, I'll talk to a little bit on an upcoming slide that while we load the verified data, we can also use the unverified data. And if we have leads, whether it's email, route box, or a 837 claim file, we may just match it and use it if it's the same policy or the same carrier. So right now, we're hoping to see from an FTE perspective the impact, but right now, not as much. But I'm thinking it's going to get there. That's a good question.
We hear different things.
Mhm.
Some folks actually reduce staff because, again, there's more automation. Some folks increase staff because there's more savings. And you've got folks, instead of having to call other health plans, about validation and things like that, they're really able to work files for recovery and things like that. So it really just depends on the plan. Again, really suggest you guys ask each other, about how that's working for you and so you understand or get a good sense of what you need for your business.
How did you track that, the savings? Was
So this particular, so this is not our savings. This was just a calculator that CQH provides, and it says, based on a certain criteria, this is what your savings is going to be, and ours may be similar or a little higher at this point, but it's more of a formula within the calculator. Obviously, for a conference like this, I can't share what those savings are, but it's similar. So we use the calculator. Yeah, yeah.
Right. This is our COB Smart calculator. It's actually on our website. We have but we actually use this. Another domain of CAQH is our explorations area, and so basically they track and benchmark what the cost of transactions are compared to going to automation. So we do have industry standards for things like the cost of a letter, the cost of a phone call, things like that. It can be hard to track COB because, as an example, your customer service folks, can you carve out in a day what they do just for COB versus other things? So there's, but again, this is a good way to at least track that, and we provide this to all of our clients, especially after go live, so they can, again, our job is to make you guys look good, our champions for the solution, so you guys could go to your leadership and talk about, the value of what you brought to your organization.
So that's part of the implementation to help you, us, the client, really be able to report back out the return on the investment back to our leadership.
More so after you go live.
Right,
After you go live. And, again, we, for many years, going live meant, being able to submit a really good file and not have, meet all the compliance and conformance and get your data back. With Ruth and Eric on board, we're really trying to get folks business ready. So we see sometimes the implementation timeline maybe stretch out a little bit, but it's so important because obviously, your good data will impact everyone, and not only it impacts everyone on the outcomes that they get. So very, very important.
Yeah, and I could tell you that from our perspective, how we report success is we look at the PMPM, cost avoidance, and we also look at, especially when we first implemented, the claims adjustments and the recoveries, and that's how you kind of model what it is that we're kind of getting back.
And vendor savings too. Right?
Well, definitely
Which
vendor
will
savings.
not be named.
Yeah, there's
Okay.
definitely a vendor savings. Destiny knows because it's our goal every year. So one of the things that we talked about a little earlier, as far as, and we had to go through this process was, when we first created the file, there were things that were said to be mandatory fields, which we populated, but not all the recommended fields we populated. And to Michelle's point earlier, the more information you could put in there. Yeah. So recommended, I would really say that you gotta really, if you have it, put it on the file, because I think that was some of our challenges originally with the testing of the files and then the information. So really treat the recommended, I think, more as a required, if you
You're
can.
going to get that from our implementation team. So that's, we've even updated the tech guide for that.
Okay. So again, this speaks again to the trend, mandatory versus recommended fields. Treat the recommended fields as required. Automate the missing member response file. So essentially, what will happen is we may send an eligibility file back out, and we may not put the member on there for whatever reason. We may have a policy or a term date from another source, and so what CAQH does is they send us the file saying, "Hey, we're missing these members." So what this speaks to is the automation. And Destiny, I don't know if you want to give a little more on the missing member file that I didn't cover.
Let me just define that just for everybody. Sorry.
Yeah.
So missing record is basically you send Michelle Toscano in 1 week as with their demographic information and coverage information, and the next week there is no Michelle Toscano. So we call them a missing record or an orphan record. So that member should have either been termed or perhaps deleted because they shouldn't have been on there at all. So again, this is cleans up the data and helps you see when you start to see trends where you see missing records increase, we work with you. Again, our account managers, I don't see our account managers here today, but they work with you on a monthly basis on your dashboard to talk about, your data quality and things that you may need to do to keep that file clean. We also have the deterrent that, we are charging you by all active members, in the system. Missing records are active members. So again, it really not only behooves everyone to clean up their data because they want good outcomes, but again, it's going to reduce your fees. So.
And then Destiny, were you going to say anything? I think you were about to.
I was just going to say that I believe that these are things like retro terms, or where the state sends us a member and then they go and void that member. So we take them out of our eligibility and then we have to actually term them for CAQH instead of just not sending it on the next file. I think that's what had happened here.
Yes, now what?
Yeah, so if it's a terminated member and you don't send it, now you're sending us stating that it's a missing record, and it's really not a missing record, it's a terminated member, so.
The member should be on the file terminated though. That's the,
Also, we should just say-
we weren't even including them. Yeah.
Okay, so to state terminated, keep the member on the file as terminated.
Yeah. And you could see here is, it took us a little bit to get that right. And then we saw the drop off on the error rate on the file, but there was, it's a process.
Yeah, you're going to learn. And again, we get all into your member data. We've had, folks find, inconsistencies within their member data that is, kind of slowed down implementation here and there. So you're going to duplicate your membership. So if you're paying, PMPY to Trizetto or for facets or things like that, again, we're going to reduce those fees for you and really, clean up that data. But things like this are data quality initiatives that we have within the program, to make sure that you guys are trending in the right direction.
And then I think, Destiny, you had sent me a chart showing the last few months we've been somewhere around the under 2% error rate. So we've kind of figured out the secret sauce there.
Yeah. Your account managers will tell you that as long as you're under 8% missing records, you're in pretty good shape. But again, the cleaner the data, the better the outcomes. Yeah. So we always recommend you guys take a look at that.
All right, and then this again, lessons learned. If we had to do it again, what would we do different? So we had when we were implementing, we had to get it in by December because Experian was they were stopping the implementation work, I guess, because of open enrollment.
Which we didn't know until late.
So that was one thing, and
we are just to let you know, and I think I've sent out emails to folks that are looking to go live or in implementation. We will be locking down. Experian will be locking down for open enrollment for I think it's 4 or 5 weeks. So I just want everybody to be aware of that, and certainly we'll let you know, and your implementation folks will let you know, so you can work with that and put it into your schedule. So, but Armand, we were caught a little off guard with CareSource.
All right, and then obviously we talked about the mandatory versus recommended fields. The number of test files may need to increase based on the timeline. And then what I mentioned earlier was since it's an approved, if it's something that you're implementing and it's an approved project, get a project manager around it. It's just a lot easier. My team handled it great. We're seeing great progress and numbers from this, but it's probably best to use a project manager. And then so where do we go from here? So one of the things that we've been doing, and I kind of mentioned it earlier, is how do we use the unverified data? How can we use this information? So some of the things like I mentioned before, we may have the route boxes, which is at the call center. Somebody's calling in or the provider's calling in to say the member has coverage. And if we see that the plan and the information matches, we'll use that unverified data and we'll script it in. We do it for all kinds of things, even on our 837 file. And then COB Smart for pharmacy. And I think in Destiny, in June, we start to get pharmacy data, verified pharmacy data.
Right.
Yeah.
Just to be clear, so today, for so many years when we launched COB Smart, you get a medical to medical overlap. We've actually enhanced the solution that now, since June, we're going to be delivering a medical to medical overlap and a pharmacy to pharmacy overlap. Medical to medical overlaps are validated. pharmacy to pharmacy overlaps are not. It is something that we are looking into. We're looking for early adopters to start doing that process to test the accuracy. And not to give it a sales pitch, but it is what I do. We do see roughly about 10% overlaps with pharmacy. So we're not quite sure what that value is. Typically it's certainly lower than a medical claim, but we feel that it's could be a really untouched market for certainly our health plans and perhaps PBMs in the future. So lots of opportunity there. Any questions?
For us,
Okay, go ahead.
For us, it's been super helpful because other vendors are not as timely with pharmacy, dental, all of those other types of health insurance. It takes them a long time to tell us about it, and it takes us a long time to tell us when it terms. And those will create member abrasion or pharmacy stoppages at the point of sale. So having that pharmacy data is in a timely manner is very, very helpful to us.